My son, Thomas Frank Williams, was born June 6, 2005. He was a happy and healthy baby, progressing normally until he received his 4-month DTaP shots. Within 3 days of receiving the inoculations, he began having seizures. He was diagnosed with infantile spasms. They immediately performed an EEG and discovered he had a condition called hypsarrhythmia, a constant misfiring of the brain. Soon, Tommy was having over 100 seizures a day. As he got older, his condition was updated to Lennox-Gastaut syndrome, a very severe form of epilepsy. Many of the experts believe Thomas had an allergic reaction to the pertussis in the DTaP shot. Thomas is now 8 years old. Over the years, he's tried about every anti-seizure drug available, some of them several times. He has also tried experimental medications. He's had a VNS implant, which is a vagus nerve stimulator, a kind of pacemaker for the brain. When he was 5 years old, he began aspirating on liquids and had to have a G-tube installed in his stomach so he could receive all his liquids and medications. Despite all our efforts, nothing has been much help to our son. The doctor's long-term prognosis is not good. We were told that he could have a seizure at any time, which could leave him brain dead or even kill him. My wife and I were ecstatic to learn that a new medication made from the cannabis plant was having unbelievable results in treating children like our son with severe epilepsy. A group of brothers in Colorado named the Stanley Brothers had genetically engineered a type of plant that contained almost no THC, the euphoric part of the marijuana plant. It was extremely high in CBDs, or cannabinoids. Technically, cannabinoids are diverse chemical compounds that activate cannabinoid receptors on cells that repress neurotransmitter release in the brain. In other words, it helps to control seizures. This new strain of plant is called Charlotte's Web because of the success it had on its first patient, Charlotte Fiji, whose condition was critical from suffering constant, debilitating seizures. After the first dose, it began to turn Charlotte's life around and her family's. Charlotte can now walk and talk and can even dance. Ever since Charlotte, child after child has been having amazing results using this new form of medicine. My wife and I, along with many other parents who have children who are suffering daily with little to no relief and whose lifespans are greatly threatened, want the opportunity to try this medicine on our children. My son's neurologist and his entire neurological institute want Thomas to try medical marijuana as soon as possible. The doctors say our son has nothing to lose, and it may be the only thing out there that can save his life or greatly improve the quality of his life. A strict bill known as the Compassionate Care Act for the legalization of medical marijuana in New York State has passed through the Assembly many times. The New York proposal was drafted with careful, strict controls. Under tight regulation, a patient who has been certified by a healthcare provider to use medical marijuana would register with the New York State Department of Health and receive a patient identification card. Specially approved organizations such as hospitals or community health centers would dispense the medical marijuana to registered patients under the Department of Health's supervision. For some unknown reason, the New York State Senate has refused to vote on legalizing the use of medical marijuana to help so many people who suffer terribly every day. The argument from some that this is a gateway drug does not apply in this case. All prescriptions would have to be written by a licensed New York State physician. Those prescriptions can only be written for the terminally ill or those going through extreme pain and suffering, and for uncontrollable seizure conditions. Some people against it have also said they do not want to see a child smoking it. This medication is given as an oil, either orally or in food or in a pill form such as an aspirin. And to date, there has never been a fatality using medical marijuana, and there has been little to no side effects. The governor has stated that he's in favor of medical marijuana for critical AIDS and cancer patients, but has not included our children. I'm asking all the residents of New York State to contact their local senators and representatives, asking them to support the Compassionate Care Act. It could be just a matter of time before someone you know or care about is suffering from a medical condition causing uncontrollable, never-ending pain. We need to take advantage of this God-given plant and use it for those who can find no other form of relief. It makes no sense that a politician with absolutely no medical background is able to decide how our loved ones should be medically treated, especially when doctors with years of education and experience are recommending it. Thank you.